being said. And I do want to start, with what Lara was saying, that somehow we have forgotten the fact that there are, different estimates, 3.7 million clinically vulnerable people in this country, to which you add their families, their carers, you're talking about 10 million people or so. And we have created a situation of, in effect, COVID apartheid, whereby it's not safe for people to go into the world, into the unsafe environments that we have. And I mean, that is a scandal of such huge proportions. And again, I know that the media are tired to some extent of COVID. At the same time, I think there's something really powerful about individual stories and individual realities and what it actually means to people. I mean, the fact that people can't go out to a restaurant, to a shop, the theatre, and whatever. And I don't think we should give up. And we're hoping, for instance, during the COVID Week of Action, to get stories together of this. It's not just that COVID is still going on. This is what it means in people's lives. Make the abstract concrete. And I still am reasonably optimistic about the ability to do that, and to remember my rage at, as I say, the obscenity of what's going on. But in terms of responding to questions, I'm going to look at three things. I'm going to start off with the pledge. Now, when we designed the pledge, we had a long debate about this, and the two options were to have a light touch pledge, which people were more likely to sign up to, or to have a systematic, if you like, inventory of what we wanted, at which point we thought we're not going to persuade anyone. The only people who are going to sign up to it are the people who are going to do it anyway, at which point the pledge acquires, it's of little help. Might be of help in terms of signaling to people, here's a premise that is okay, but it won't increase the number of those premises. But the decision that we took to start off with the light touch pledge is in itself meaningless unless there is a process which follows on from signing the pledge. And the whole idea of the pledge was that it would be a matter of employees and customers going to employers and asking them to sign the pledge, and then using that as leverage for further things to be done. So, for instance, if as a trade union branch, you get an employer to sign up, you are then in a position to make a whole series of demands. And that's worked in some of the places where the pledge has been signed. Knowsley Council is an example. They were able to, for instance, change the regulations about sick days, because if you take so many sick days, you'll then, it's then questioned. But COVID sick days didn't count. Now, that was a real material and important change for the lives of those people, but it also improved the safety of those people. So my answer would be, to those of you who find it vague, to say, I think what it does is set up a context in which you can then raise specific demands. And the question is how you do that. Now, I think in trades unions, that's easier, and that's why we're working through the trade unions. But we would also like to see the trades unions coming together with local community groups so they can work together in making sure that things are implemented. And one of the things we would ideally like to see would be in the localities for meetings to be organised, perhaps through trades councils, but certainly for trade unionists, members of the various community groups, to come together and first of all try and get the pledge signed, but once it's signed, then use it, because it does talk about very clearly about, in a sense, auditing the practices in the space to make sure that they meet health and safety requirements. So, as I say, the pledge is important, but the pledge isn't an endpoint; it's the process. And people involved in getting the signature also need to be involved in that process of moving things further forward. And to say, in the places it's happened, that's been very effective indeed, and has led to very concrete changes which have very concrete consequences. The second thing I want to raise is, in a sense, the discussion that I think is raised by this notion of a national medical service. Because one of the clearest things for me about COVID is it bust the Tory ideological shibboleth that private is better than public. I mean, what we saw, for instance, in Test and Trace is private contact tracing doesn't work. Somebody phoning you up who doesn't understand the locality, who's not part of the locality, who's not trusted and asking you to give all sorts of personal information, you're not going to do it. If you have, a local service where people are known, where people are trusted, where people know the locality, what's sometimes called shoe leather epidemiology, that works. And the contact tracing that was powerful was that in the public sector, not in the private sector. I think also similar issues go for public versus private in terms of medicines. You're quite right. There was a huge scandal of the huge dividends being paid out to the shareholders. But the biggest scandal of all, I think, and again, I think we mustn't forget this. I mean, we talk about the fact that it's not all over, but we've talked almost entirely in this conversation domestically from a UK perspective. And when you look at the scandal was always the fact that the vaccines weren't rolled out internationally because the drugs companies wanted to keep their profits, that they weren't prepared to allow them to be manufactured in various places around the world so people around the world were safe. And we also had that slogan, no one's safe until everybody's safe. And we've forgotten about that entirely. So one thing I hope we don't forget when we talk about COVID action and we talk about the fact it's not all over is that international dimension. And as I say, I think one of the biggest scandals of the privatization has been the fact that, on the whole, the vaccines have been used by rich countries where people can pay. I mean, I might get the statistics wrong, but I seem to remember that had the WHO target for global vaccination, which wasn't that high, I think it was about 60%, had been met by early 2021, it would have saved 600,000 lives. 600,000 people died because we didn't roll out the vaccines internationally. I mean, this was a genocide of staggering proportions. So I take that point very, very strongly. But as I say, the international dimension mustn't be forgotten. And then finally, I think are really important for the future, these notions about framing and the notions about personal responsibility and social responsibility. If I had to think of two emblematic moments in the pandemic in terms of what they told us about our society, the first was the very clear evidence that care homes, which had poor employment practices, 0 hours contracts and the like, were more likely to see more deaths for the simple reason that the underpaid workforce then had to work in multiple care homes, move between care homes and move infections between care homes. 0 hour contracts then became a health issue, a life or death issue. And perhaps even more staggering, perhaps I shouldn't be staggering. If you remember, I think it was February of last year when Boris Johnson made the "it's all over" announcement. He was asked about people who are sick staying at home, right? And he said, I would like us to have a culture more like the Germans, in that when people are sick, they stay at home, right? Now, what is staggering about that statement is the difference between us and Germany isn't so much a matter of culture. It's a matter that in Germany, you get your pay if you're sick. And in this country, we don't. It's a material issue. It's not an individual cultural, I choose to be at home. It's a structural issue. And the other thing that we've learned absolutely clearly is all these issues of health are fundamentally to do not with individual choice. Dying, as I was saying at the start, in COVID wasn't because you were irresponsible or stupid or you didn't know the rules. It was because you were exposed more, because you had less resources to keep yourself safe. And I think there's something really powerful, number one, reframing these various issues as health issues. So I remember, for instance, if you remember, one of the most successful policies of reducing gang violence, in Glasgow in particular, came from reframing it not as a criminal justice issue, but as a health issue, and therefore not seeking, repression and retribution, but actually looking at how you could support and mitigate. And so there was a very successful program which involved, number one, making it pretty clear to people that if you were involved in gang violence, there would be consequences. Secondly, to create pathways out of gangs with employment and so on. And thirdly, to include families and communities to show people the impact on communities. So I think we do need to reframe things as health. But the corollary of that, the other side of that, is that we need to reframe things as public health. Again, we spend so much on high-tech health, high-tech interventions, that we forget about the obvious things that are really important. Now, that's true in terms of physical health. I think adding clean air to clean water, but it's also true in terms of mental health. And again, we haven't talked about enough about mental health, I think. And one of the things that came out immensely clearly from the pandemic was the fact that connection, loneliness, and so on are absolute epidemics in our society. One of the reasons why we have problems is that the structure of the labor force has changed. Many years ago, you tended to work where you were born. Now people move around. So by the time they're old, they don't have their family near them. They don't have their kids near them. They're lonely and they're old and they suffer because of it. Although actually, even more young people, when they move away to work, they're the ones who are lonely. So again, loneliness is a public health issue. Right. I remember people when Jeremy Corbyn talked about the internet being free for everybody and available for everybody, thought it was completely bonkers. After COVID, we realized actually that's a very sensible and very basic public health demand. So I do think that we need to reframe health from individual technical interventions. I mean, those are important. I'm not decrying them, but they're not the be-all and end-all. We need to think much more in terms of public health, and we need to reframe a whole series of basic issues as basic health rights. It should be a basic health right for everybody to be able to exist in safe environments and to go out into those safe environments. It should be a basic public health right for everybody to be connected to others and to be part of community. And there's far more of it. And I think if the question, will the government do it? Of course, it won't do it without a concerted attempt. But for that concerted attempt, there needs to be a clear vision. And I think events like today help build that vision and build that campaigning. And I often use this quote, but I'll finish with it. It's one of my favorite quotes of all time. It's from the Italian social theorist, Antonio Gramsci. He talked about pessimism of the intellect, optimism of the will. Intellectually, I don't expect much from this government, but I am determined, and I hope I speak for all of us when we say we are determined to have a notion of health which is humane and effective and inclusive. And I think events like today are an important point of beginning to build that. So I'll finish on that note.